My name is Rebecca Milliken-Slater and I'm a consultant pathologist here at Leeds Teaching Hospitals Trust. So there are many different types of pathologists, one of which, such as myself, look at pieces of tissue down the microscope. Some of these pieces of tissue are small, such as breast biopsies, which I'm looking at to determine whether there is cancer in them or not. Some specimens are larger and are part of the treatment of breast cancer once a patient has received a breast diagnosis. And in these cases, my role is to check that the cancer has all been removed and to look at particular features to guide subsequent treatment. So the breast pathology team here in Leeds receive and assess almost 3,000 breast biopsies a year, and about a third of these will end up with a diagnosis of breast cancer. We also receive larger breast cancer excisions from approximately 650 patients a year. So the current biggest challenge in my job and nationally in pathology is an increasing workload, and this is due to there being more specimens coming in from patients, but also we need to do more and more tests on the specimens we receive. The digital pathology is in essence turning a glass slide with a piece of tissue on it into a digital image. This means that rather than looking at a glass slide down a microscope, similar to the microscopes that you might have used as a child, I can look at a slide on a computer screen. This has three key advantages. One, I don't need to wait for the physical glass slides to be delivered to me in order to look at them and issue a report. So as soon as the laboratory has made the slides, they're available for me to look at via computer. Two, I find that I am quicker at looking and diagnosing breast cancer on digital images rather than using a traditional microscope. And three, if I need to look at previous specimens for a patient, they're immediately accessible via my computer rather than having to go to the basement archive of glass slides. All of these mean that the turnaround time for my breast biopsy reports and breast excision reports are quicker, which reduces the anxious wait that patients have for their results. So NPIC has provided the funding and much of the infrastructure to allow us to adopt digital pathology here in Leeds, which is something we wouldn't have been able to do otherwise. It is also committed to the rollout of digital pathology across Yorkshire, which means that we will be able to share slides between different hospitals much more conveniently and effectively rather than packaging glass slides up and posting them. So as well as making me a more efficient reporting pathologist, digital pathology also opens up the avenue of developing artificial intelligence tools to help in the diagnosis and assessment of breast cancer. MPIC are also supporting this, and I am currently doing a project with Leica Biosystems that will aim to develop AI tools to help me diagnose and assess breast cancer quicker and more accurately. This will further result in improved turnaround times for reports to patients. In addition, artificial intelligence tools may well start to recognise patterns in breast cancer that we currently don't appreciate. These could then pave the way for us to be able to give more accurate prognosis to patients and even potentially develop new therapies which improve patient survival.